The treatment we're using is Plaquenil or hydroxychloroquine, okay? We use 100 milligrams twice a day, and in addition to that, you have to have the zinc to go with it. Otherwise, it doesn't work, okay? The Plaquenil sets it up. So what it does is normally we can't put our zinc into the cells very well. So with Plaquenil acts as a conduit. It takes the zinc and it drives it into the cells, okay? Normally, you could take a wheelbarrow full of zinc and you're not going to do any good. So I'm not a big promoter of that for viruses, but in this situation, we are kicking its rear end with this stuff, and it is doing a great job. People are tolerating the medicine very well. It is in my words, a cure. Okay, now some people worry about that word. They're like, well, what do you mean cure or treatment? I treat diabetes. I treat high blood pressure. I can cure you from strep throat. I can cure you from COVID-19. Okay, this medicine, in my books, in my words, it's a cure. They're done with it. I had an 87-year-old gentleman that was in here 4 to 6 weeks ago. Fever 103. He was better in 24 hours, out mowing his yard next day. I mean, he was sick when he got here. I just treated an elderly couple out in the parking lot. Again, 103 fever, 102, something like that. Been going on about 3 days. I wish he had come in sooner because a lot of people are staying home because they don't know there's a treatment. So they end up in the emergency room with fever and very sick, short of breath, bad sore throat. All of that could have been avoided if we just start the treatment early. We don't need to use this high dose, and if we aggressively treat it, then we can change the course of this whole treatment, this whole disease. Hydroxychloroquine is an antimalarial that we've known for 60 years. I didn't come up with this treatment. I was searching for treatments back around March the 10th, and we had nothing. I had nothing. Their original predictions of millions of people dying was probably pretty darn true until this treatment showed up about March the 10th, 13th. And my first patient I treated was on the 13th. But it was a guy named Dr. Chenault from Johns Hopkins University. He's on YouTube or something like that. Episodes 32 and 34, if you want to go look at it. And he explains how the zinc and the antimalarials work together. It's a beautiful description of it. His first episode, which I watched, was rather depressing because he said zinc stops the cells from the viruses from replicating, but we have nothing to do that, and we have no way of driving it in. And then he got an email from somebody at the University of Oklahoma, and on his next episode, 34, he said, hey, somebody told me from Oklahoma that they used the hydroxychloroquine to drive the zinc into the cells, and it works beautifully underneath the microscope. And he said, I haven't applied it on the street yet, but as soon as I got off that episode, I thought, I know I will, because I didn't have any bullets to shoot at this thing, and all of a sudden I had a whole arsenal full, and we had been very successful.
Now, are you treating patients who are testing positive, or who are you determining who you treat?
Well, I'm going back to the 1980s as far as treatment goes. Before the strep screens came out, if we saw somebody that clinically they looked like they had the history of it, you treated it, okay? And that's the reason why we had to go there, was because the treatments were the testing was so slow. I mean, it'd be 3 to 5 days. I got an 87-year-old gentleman with 103 fever. I'm waiting 5 days for the test to come back before I treat. Not this guy. I'm going to jump on it right away and then wait and see if the test comes back. Or by the time he gets better in the next 48 hours, I'm just saying, hey, I think we're on it. Stay on the medicine. It's not that bad to be on it for 10 days. That's not going to cause all this nightmarish stuff. And the things that I talk about, the naysayers, is mainly, what do you got? What do you have that will fix it? A ventilator? A breathing machine? I mean, you got nothing.
How are your patients doing?
Excellent. I've had 2 of them that had to go in the hospital. And then an older lady with diabetes and some other stuff. And then there was one girl who came in, and she's pregnant, about 20 weeks along, and I was a little hesitant to start the Plaquenil on her, hydroxychloroquine. So I tried the Z-Pack with zinc. I thought, hey, let's try this. Well, it didn't work. So she came back, and we talked a long time about it, but people get pregnant in malaria country too. So I had assumed that they would have a safety profile with it, and it did. The Plaquenil has been used in pregnant women before. I'm not saying it's like taking a Flintstone vitamin, but if you're looking at COVID-19, you take the pill, okay? And you save yourself and you save your baby. And she was in the hospital, but they continued the medicine on her while she was there. And as I understand, she came home, and so did Grandma. So that was a family of 5 people that all had the same problem. So And one of them was positive. So I knew that they all were.
How many people have you treated so far? Do you have any idea?
Estimate since March, I started my first treatment on patient 0, March the 13th. And, Henderson, we're not in the epicenter. So I would say 14 to 20 I've treated. Today I treated 2 more. Yesterday I treated 2 others. So we may be around 22, 24 because this area is starting to heat up a little bit. But I just want everybody to know there is a treatment and we can fix this thing. Don't wait till the last minute.
And are they experiencing any type of side effects?
I haven't had anybody have side effects. And the reason why is with hydroxychloroquine, they say that if you're on a prolonged and high dose, then you got a problem. It may, and it's a maybe a problem, okay? Because I have patients in my practice been on hydroxychloroquine for years. Some of them for lupus, some of them for, there's a dermatitis you get with the sun that helps them, and they've never had any problems. I mean, I check their eyes and do the routine checkups with it, but I've had experience with this over my 40 years of practice, and it's not like, and that was part of my aha moment with Dr. Chanel. When he mentioned hydroxychloroquine, I was like, hey, I've used that drug before. I don't have any problems with that. We'll go with it. If it's for 10 days, that's a no-brainer.
So what is the dosing?
The dosage I use as an outpatient can vary from 100 to 200 milligrams twice a day. I try to load them up a little bit at first. Now that's less than what you use a patient, an inpatient in the hospital. The FDA has approved a lot higher doses for hydroxychloroquine if the patient's admitted to the hospital. But I try to use the lower dose, and it's working. And I figured for 2 reasons. First of all, I could save some of the medicine for other people if we use a lower dose. The second reason is I could save them from any side effects and still get. Now I wanted to see did I get effects, did I get the positive effect of the medicine with a lower dose, and I have, as long as we start early.
Now, catch me up on where the FDA is on this.
I'm not an expert, but I can tell you the last I saw from the FDA, they were saying that you use doses of 200 to 400 milligrams twice a day, close to 800 milligrams to start with, and then you begin to back off. And that's what's happened to my patients that we didn't do a complete treatment with. As an outpatient, they were admitted. They bumped up the dose of the Plaquenil. They didn't stop it. They raised the dose. And we also raised the dose of the zinc. So you get that 1-2 punch going, and it's been a very good response. It's already approved. I mean, this drug is already on the market. It's been on the market for 60 years, so we don't have to go through that again. When you're in the midst of a pandemic, which none of us have been through before, I kind of imagine it like a battle in Vietnam or something, where you're in there with your platoon trying to get them home and get them safe, and whatever you're doing is working. You don't wait and call the command central and ask them, is it okay? You just keep doing it until you get your folks home, and that's what we're trying to do, is get everybody safe.
Now, would you recommend this for other doctors to start using?
Absolutely, without any conditions. Get these people on this medicine early. Do not wait until they're short of breath or they're having severe symptoms. Start them early, and if you can't get the testing done, or if you do absolutely do the test, while you're waiting for the results, start them on the treatment. Just start them, and then if you want, you can stop it later, but what if the test is wrong? And then, so if the patient's better in 24, 48, 72 hours, and the test is negative, I've had some negatives that I kept them on the medicine because sometimes tests are wrong. So, and I'm not going to take a chance of that happening to my patients.
Some of the people you have treated have been positive.
Yes.
Okay, just double checking.
Yes, some of them have been positive.
Now, if somebody wants to be treated, what do you suggest?
I've had some calls of people saying, "Well, I'm afraid I'm going to get it. Can I have a prescription?" I'm like, absolutely not. The supplies are not known as far as how much we got, and I'm only going to use it on people that have symptoms. If you got a sore throat, if you got a cough, if you got fever, if you're sick, you need to be seen by the doctor or talk to them how they do their telephone things or somewhere. You need to have a physician guiding you through the treatment because you want to make sure that you're taking the appropriate level of dose and that you're also getting that zinc. You need both, and they can be sometimes hard to find. So. But most pharmacies are pretty well stocked up with this drug. But we're using such small doses. I don't think we're gonna make an impact on the local supply whatsoever if we just keep it low. I think the thing that struck me the most about this pandemic is that I've been following this since Christmas, and I've been losing sleep, and I haven't done very well. My wife kept asking me, "What's your problem?" I'm like, "Well, Okay, I'm going to tell you. And this is about mid-February. And, you know, I had nothing. I didn't even want to plant a garden because I thought, well, I'm not going to be there to harvest it. What the heck? You know, so, but as of March 10th, through the grace of God, we have a treatment. And I'm telling you, I've been raised all my life with the thoughts that, or somebody always think, you know, you can't treat the common cold. And that's what's so dangerous about this. They've attached the common cold virus to SARS virus. And when those two are together, it makes it spread like wildfire. And, you know, when you've got a common cold, as far as I knew, there was no treatment, and there hasn't been. But all of a sudden, this treatment showed up. I mean, I don't know why it did, but it was there. And I began to, you know, feel like I was going to live through it, and my family was, my grandkids. I mean, I was looking at everybody thinking, this is going to be rough. But now we've got something to shoot at it. I'm shooting as fast as I can.
Now, do you think that this could be ultimately a cure for the common cold when this is all over?
I've toyed with that, and I'm like, well, trying to tell somebody to take some Plaquenil for their common cold and zinc, I think they ought to just ride it out. You know, but if it's COVID-19 or something in that range, yeah, let's go after it. Let's kick it.
Anything else?
No, one thing, this war's over. We are winning this war. It's over.